nurse colleagues. Lily Jelinas, Editor-in-Chief of American Nurse Journal, here to wish you Happy Nurses Week and to share highlights from our May 2026 issue. In keeping with the theme of celebrating nurses during this special time for our profession, this exclusive Celebrating Nurses edition announces the winners of the 2026 All-Pro Nursing Team Awards. This month's continuing nursing education topic is Differentiating NSAIDs, Understanding COX-1 and COX-2. This article discusses how NSAIDs affect COX-1 and COX-2 while highlighting key nursing considerations such as monitoring for gastrointestinal bleeding and for changes in kidney function and cardiovascular risks, and helping provide safer, more informed patient care. The feature article this month is Managing Cerebral Spinal Fluid Drainage, Challenges and Technology Recommendations. This article discusses the complex and time-intensive nursing care required for patients with externalized ventricular and lumbar drains. It highlights the serious risk patients face if these drains are not managed properly and the role of advanced technology in reducing risk and supporting high-quality neuroscience nursing care. Another important article, Flagged and at Risk, an algorithm to remove inappropriate behavioral flags in the electronic health record, shares insights from examining how negative implicit bias can affect care for patients who are labeled as being at risk for violence. It highlights how behavioral flags in the electronic health record, while meant to improve safety, can unintentionally reinforce bias, and why it's important to regularly review safety practices to ensure both staff protection and equitable patient care. Given the increase in vaping in our society today, the article Youth Vaping Detection in Primary Care has important guidance for nurses. Patients in the primary care setting require screening with a validated tool for cigarette use and vaping. Stay up to date by understanding the importance of vaping screening in primary care, barriers to effective screening, and recommendations for validated screening tools. Don't miss the article, The Legal Risk of Nurse Bullying in Critical Care. Preventing nurse bullying is more than an organizational morale issue. It's a risk management and patient safety imperative. With growing regulatory oversight and public awareness, healthcare organizations have an obligation to take meaningful steps to prevent, detect, and respond to bullying behavior. And finally, the Inpatient Stroke article discusses the increased risk of stroke among hospitalized patients with hypertension, atrial fibrillation, and advanced age, and emphasizes the early recognition of stroke symptoms, prompt diagnosis, and timely treatment, leading to improved clinical outcomes. To recognize National Nurses Month, my editorial, titled National Nurses Week 2026 More Than a Ceremonial Pause, celebrates and honors acknowledging in today's environment of workforce shortages and burnout, recognition is no longer optional, it's essential. Each issue of the American Nurse Journal provides American Nurses Association information, including the Practice and Ethics columns, the American Nurses Association President, Dr. Jennifer Mensick Kennedy's message, and the Association's Frontline Nurses section. Thank you for reading American Nurse Journal and for the care you give our patients every day. This month, please take a moment to acknowledge the difference you make and be sure to recognize your colleagues as well. Nurses who support each other support the profession. I'll see you next month.